Okay, am I audible? Am I audible?
Yes, sir.
Giri? निखिल आवाज येतोय का?
हो सर, येतोय आवाज.
ओके, आणि हे दिसते का पीडीएफ दिसते का तुम्हाला ही?
हो सर.
Okay. So this time, instead of going for PowerPoint presentation, we are going to discuss about your practicals, right? So which practicals you have and which practicals are in your syllabus, right? We are mainly going to discuss second unit test practicals. So we have practical manual. Okay, so this is biochemistry practical manual. Under unit test, you have this practical concentration of solution, system international units, units preparation of buffer, then preparation standardization of acid and alkalis, titration curve of acid versus base. So this was in unit 1. Then qualitative test we have seen, that was qualitative test for monosaccharide. So basically the qualitative test for carbohydrates, so monosaccharides, and later for disaccharides and the polysaccharides. Then there is a practical named determination of acid number of oil, then precipitation reactions of proteins, then color reactions of protein, then estimation of amino acid, Sorensen's method. Next we have effect of temperature and pH on the enzyme activity. So these are the unit 1 practicals. Under the unit 2 practicals, we have estimation of the blood or plasma glucose, then estimation of the serum protein. Next is the estimation of the serum albumin or globulin. Next we have estimation of somebody's mic is on, I think. Please keep your mic off. Nikhil. So estimation of the serum inorganic phosphate, estimation of the serum calcium, estimation of the serum magnesium. Then we have estimation of ascorbic acid, dichloroquinolidinol, DCPIP method. So ascorbic acid we can estimate. Then we can estimate the milk lactose by the Benedict method. This is a quantitative method. Then we can estimate the sodium by the flame photometer. So basically in the unit 2, we are going to estimate the glucose, serum protein, serum albumin globulin ratio, then inorganic phosphates, serum calcium, serum magnesium, ascorbic acid, then milk lactose, and the sodium by the flame photometer. So let's go to the our first practicals. We call it as a serum glucose estimation. Let's go to glucose estimation. So here basically we are going to try to read from manual, as well as some difficulties come, we will try to search on internet for the relevant things, right? So this approach we will try. Let's see how it goes. So we have blood sugar or blood glucose estimation. So this is the blood glucose estimation of the blood glucose or the blood sugar. So blood glucose estimation, so clinical significance. So any practicals, we are measuring the blood glucose or blood protein or cholesterol because it has some clinical significance. So let's see. A request of the serum glucose analysis made in the case of suspected diabetes mellitus increase the serum glucose level, hyperglycemia with the glycosuria for the diagnosis of the diabetes mellitus. Okay. So somebody has diabetes mellitus means that person diabetes mellitus. So if diabetes mellitus condition is there, so in that condition, we are expected to get some increase in the these things, right? So this is a diabetes mellitus. So here we can see, so this one is a pancreas and this is the intestine, and you can see if insulin is there, the glucose is getting inside our cells. Okay, so on our cell there is a insulin receptor. So these are the cells, these are our cells, and this is the insulin secreted by this pancreas. So this yellow is a pancreas. Now once this yeah, blue insulin molecule attaches with this insulin receptor, what happens is that this glucose get entry inside the cell. So now it has got entry inside the cell. This is a normal healthy individual what we expect. If it is a type 1 diabetes, the insulin cannot be secreted from this yellow pancreas, so pancreatic failure to produce the insulin. So what happens if insulin is not there? This insulin receptor doesn't get insulin. So in this case, uh, this glucose cannot get entry inside the cell. So we get energy deficiency here. Next, type 2 diabetes. So we have insulin, but this receptor, insulin receptor, so you can see blue receptor is like this. Now this receptor has mutated and it has changed shape. So because of that, in the type 2 diabetes, even though insulin is present, it cannot attach with the insulin receptor. Because of that, the glucose cannot get entry inside the cell. So cell fail to respond to insulin properly. So that was about the diabetes mellitus. So whenever we talk about glucose, we talk about this diabetes mellitus condition in which the glucose is unable to get inside our cell. So basically the glucose get absorbed from intestine into inside our blood, and we want that glucose to go to different tissues or the cells. If it is not getting properly distributed to different tissues of the cell, what happens is that there is a hyperglycemia condition. So this is a hyperglycemia condition is hyperglycemia condition. So this hyperglycemia condition we can see. So the glucose increases in the blood, and this glycosuria. Sometimes this glucose get excreted via urine. So this is a glycosuria condition can be seen with the diabetes mellitus. This is a conducted for the this is conducted for the glucose tolerance test and the increased level of glucose as noticed with the endocrine activity and the pregnancy. So with the glucose tolerance test, we can know how much glucose is present. So we will come to glucose tolerance test again, right? A decreased level of the serum glucose, hypoglycemia is often associated with the saturation, hyperinsulinism, and decreased activity of the endocrine gland. So if you have hyperinsulinism, too much insulin is secreted. In that case, your glucose get entry inside the cell very quickly. Or if you have some endocrine disorder, in that case also the glucose sometimes get entry inside the cell very quickly. And in that case, you can have the condition called as a hypoglycemia. So in this one, we are clinical significance, we are seeing the hyperglycemia, and second clinical significance we are seeing is the hypoglycemia. So glucose kit is based on the Trinder method. So Trinder method means the glucose oxidase and peroxidase is used along with the phenol and the 4-amino antipyrine. Okay. So in this, so first. So whenever we are discussing glucose estimation, one method is a glucose kit. Okay. So in our lab also we have this kit. We can do the glucose estimation by the glucose kit or otherwise by the Folin Wu method. Okay, so there is a conventional method and there are the enzymatic method. Enzymatic methods tend to be quicker, tend to be on the quicker side. So let's see what is this glucose kit. So it is based on the Trinder method. So maybe based on the scientist name, Trinder method. In this one, we have enzymes, glucose oxidase and the glucose peroxidase. In this one, we are using phenol and the phone amino antipyrine. Okay. Increased glucose level, hyperglycemia is observed mainly in the diabetes mellitus and other diseases like the hyperglycemia. Okay, so we want to see whether glucose is increased or decreased. So increased glucose with the hyperglycemia already discussed. Decreased glucose level or hypoglycemia occur mainly due to the overdose of the insulin. So if you are giving somebody overdose of insulin, then in that case, this person may suffer the hypoglycemia. Hypoglycemia means decreased glucose level. It is observed in the other condition like hyperthyroidism. So if person has a increased thyroid activity or hypothyroidism or and adenocorticism, that case the decreased thyroid activity or increased thyroid activity or adenocorticism, the adrenal glands, the activity gets decreased. In that case, this hypoglycemia can be observed. So whenever we say glucose, we are now dealing with the glucose estimation. So we should know the normal values of the glucose of the serum. Use serum. So it's determined as a reducing substance. 70 to 110 milligram per deciliter or 65 to 95 milligram per deciliter as a true glucose. Okay, so this value can be the this range. Okay, so reducing substance 70 to 110 milligram per deciliter. So whenever we say milligram per deciliter, so milligram per deciliter means 100 ml. Okay, so if you see deci is a 1/10. Okay, 1/10 of the liter is a 100 ml. So this deci is a 70 to 110 milligram per deciliter. So the glucose concentration, this is a normal glucose concentration, and this is a true glucose concentration, 65 to 95 milligram per deciliter. Uh, as a true glucose concentration of the glucose in the serum, about 15% higher than the whole blood. Okay. If you are seeing ruminants, the ruminant blood glucose level is the 40 to 60 milligram per deciliter. So if you see the humans, the range is quite higher, 72 to 110 milligram per deciliter. So if you take 100 ml of the blood, you can find the value in that blood sample as a 70 to 110 milligram per deciliter in the human. If you are seeing the ruminants, this value is on the lower side. That is a 40 to 60 milligram per deciliter. Okay. So the evaluation method, commercial kit for the glucose oxidation is available in the most developing countries. These are there are three methods. So we have this kit-based method also available. So this is a kit-based method. Third number, glucose oxidase method. Other method is the Folin Wu method and the O-Tulidine method. Of these methods, only the enzymatic glucose oxidase method is specific for the glucose, while other are the non-specific. So this glucose oxidase method is very specific. So enzymatic methods tend to be specific. So these two methods are there. Folin Wu method is there, glucose estimation, or Tulidine method is there. Next method is a glucose oxidase method. Specimen. So what specimen to use? The serum plasma or whole blood can be used along with the fluoride with oxalate as used as an anticoagulant. Okay, so we can use a serum plasma or whole blood with a fluoride oxalate used as an anticoagulant. So we can use an anticoagulant as an oxalate. So fluoride helps to stop the breakdown of the glucose plasma with the fluoride should not be used in the glucose analysis by the enzymatic method. Okay. So This is an enzyme inhibitor. So fluoride is used as an inhibitor in the glycolysis. So we are using this fluoride here. It is mentioned that glucose fluoride should not be used for glucose analysis by enzymatic method. Anticoagulant for the 10 ml of the blood. So if we are using anticoagulant, we can use the potassium oxalate or the sodium oxalate 20 milligram, sodium chloride 20 milligrams. So these are the anticoagulants you can use if you are planning to use the whole blood, or if you are using planning to serum. So how to isolate serum isolation? So how to do the serum isolation? So this is a serum isolation procedure, right? So most of things. So during the most of our biochemical analysis, we are going to use the serum, right? So let's see how to make that serum. So there is a difference between the serum and plasma, right? So if you are taking the blood sample, intravenous blood sample, and if you are, so you have collected blood sample in this vial, okay? So this is a blood sample. Now this vial you have kept in the slanted position. So for example, like this. So this is the cuvette where you have collected blood. If you are keeping it in the slanting position for some time, then this blood will clot here. Okay, so blood will clot here and serum will oozes out. So ideally you should keep this in the slanting position at the 4 degree. So this is a serum. So it means that the serum contains the blood coagulant factor, so the blood get clotted. Whereas in the this is a plasma. In this one, we are putting the anticoagulant factors. So anticoagulants means it will won't allow blood to clot. So if you centrifuge this blood, whole blood, you will get RBC, you will get WBC and platelet in the middle layer, and you will get plasma here. So serum is basically plasma minus coagulating factor, or you can say the plasma is equal to serum plus clotting factor. So that was about the serum, how to isolate the serum for our biochemical test. So this is the test. And why we are using this sodium potassium oxalate? If you are planning to use the anticoagulant, then you can use. But ideally, we use the serum sample for the blood glucose estimation. Now coming to the method of the estimation. Okay, so we are seeing here there are three methods: Folin Wu method, Oat-to-leading method, and the glucose oxidase method for the glucose estimation. Let's see the glucose estimation. So this is a God-Pod method. So God-Pod method means GOD POD method. So ideally it should be pronounced GOD POD method. So that is a glucose oxidase peroxidase method. GOD stands for glucose oxidase and POD stands for peroxidase. Okay, so this is a God-Pod method. So GOD POD method, glucose oxidase peroxidase method. Okay, let's see where it is being used. Glucose oxidase. So let's talk about this portion. So we have glucose present. If this glucose oxidase act here, this glucose get converted into the gluconic acid plus hydrogen peroxide. Okay, so this is a glucose breaking down into the gluconic acid plus H2O2, that is hydrogen peroxide. Next thing we have is the H2O2 formed here. Okay, let's take this H2O2 and add phenol plus 4 amino antipyrine. So if you are adding H2O2 plus phenol plus 4 amino antipyrine in the presence of POD. So this is a POD portion, and if you are combining these three, H2O2 plus phenol plus 4 amino antipyrine, we are getting the red quinamine complex. So the red color we are getting. So basically we are interested in the some color. So whenever we are estimating the biochemical test by the quantitative method, most of time we are interested to get some particular color which is particular for that compound. So we have particular compound glucose here, and we are interested to get the particular color. So here we have glucose, and now we are interested to get some color. So let's combine this. Let's add glucose oxidase. Okay, glucose oxidase added, gluconic acid plus H2O2. Okay, that's it. So next H2O2 plus phenol plus 4 amino antipyrine added. Okay, next we utilize this POD enzyme. Okay, here we have ultimately got the red quinonamine complex. Okay, so this is a complex red quinonamine. So we have got some red color, glucose oxidase peroxidase. So now the intensity of this color is proportional to the amount of the glucose present. Okay, if you have very little glucose present in your serum sample, you will get very little red color formation. If you have medium color glucose, you will get medium color red color. If you have very high glucose, you will get very dark red quinonamine complex, right? So based on the glucose, we can see color intensity changes. So there, that was a qualitative, but if you are taking the optical density reading with the spectrophotometer, in that case, you can get the particular red color. Uh, uh, Based on the red color intensity, we can estimate the quantity of the glucose. Okay, so that is a principle. So any biochemical test principle you are going to see, the equations like that. Okay, this is a chemical equation, and it basically tells what reagents are reacting and how color is being formed in this reaction, right? So this is glucose oxidase peroxidase. So this is a principle of this reaction. Let's see. We have somewhere described about these reagents, right? Previously. Okay, here we have this initially when we are discussing the experiment number 10, estimation of the blood glucose estimation, blood sugar or the glucose estimation, we saw glucose kit. So this kit is based on the Trinder method. This is the Trinder method in which glucose oxidase and peroxidase is used. Okay, we have used glucose oxidase and peroxidase as we know. Then we have with a phenol and 4 amino antipyrine. So we have used here glucose oxidase here, then peroxidase here, then phenol here, 4 amino antipyrine. So whenever kit is there, enzymatic reaction mixtures is there. You should know that it contains glucose oxidase, glucose peroxidase, phenol, 4 amino antipyrine. And these other reagents, gluconic acid, H2O2, these are the produced as a product of first reaction, and red quinonamine is produced as a product of the second reaction. So this is the principle of this test. So now what? Let's see equation: glucose milligram per deciliter. So here we discussed the ruminant blood glucose level is a 40 milligram per deciliter. So how to deduce that glucose level? Let's check. We have glucose here in the milligram per deciliter. So this is the equation: optical density of unknown divided by optical density of standard multiplied by concentration of the standard multiplied by dilution factor multiplied by 100. Okay, so this is the equation for this one. Okay, so if you are taking, for example, optical density, suppose optical density is a 0.1. Okay, this is for just supposition 0.1, and standard reading is also 0.1. Concentration, for example, it is the 10 milligram per deciliter. For example, okay, here 100 milligram per deciliter using. Okay, so 100 milligram per deciliter if you are using, and dilution factor is 1. And if you are multiplying it by 100, so it will be like 10 raised to 4. So 10,000 milligram per deciliter, right? So this is how we can deduce these things, right? So basically, this is a way of representing. Okay, so enzyme reagent, when we say enzyme reagent, we know it is a God pod plus phenol plus 4 amino antipyrine. So likewise, so how to do this test? The enzymatic reagents. So this is a calibration chart. So whenever we are doing some procedure, we are using this calibration chart. So here the serial number 1, 2, 3. These are the reagents, and these are the 3 tubes. We want to keep 3 tubes ready: blank, standard, test. So you take 3 tubes, 1 tube for blank, 1 tube for standard, 1 tube for the test. Under for the both all 3 tests, you add 1 ml enzyme reagent in the blank, 1 ml enzyme reagent in the standard, 1 ml enzyme reagent in the test. Okay, so these tests, 3 test tubes are ready. Now next, we want to add standard. The standard is 100 milligram per percent. 100 milligram per percent standard means, this standard means what we are estimating? We are estimating the glucose. So if you are taking the 100 ml of the 100 milligram of the glucose, and dissolving it in 100 ml of the water. So 100 milligram glucose dissolve in up to the 100 ml water. So that is the standard of the 100 milligram percent. And this 100 milligram percent solution, 10 microliter we are adding in the standard solution. So this is the standard reaction. Next, we have collected serum or our specimen. Our objective is to know the quantity of the glucose present in this serum. So we add the serum 10 microliter to the test. Okay. So these three tubes we have taken blank. We have added only enzyme reagent. If you see in the standard, we have added enzyme reagent plus 10 microliter standard. So standard is basically a glucose. So this will follow this reaction and it should give the red quinonamine complex. And we know that for 100 milligram percent glucose, we should get particular intensity of the color. And now here is a test: 1 ml enzyme reagent plus serum or the specimen. We expect if glucose is present ideally in the serum, so we should get some color, and intensity of this color should be proportional to the how much glucose is present, and that is why we are following this equation. So optical density serum, it is getting some optical density based on how much intensity of color is there. The standard optical density of standard. So this is the standard tubes standard. So this standard optical density we are putting here, the concentration of standard multiplied by dilution factor likewise. Okay. So So this equation here, three tubes are ready with us. So whenever we are going to do the practical in our lab, we should prepare this tube, blank, standard, and the test. Likewise. Next, mix well and incubate at the 37 degrees Celsius for the 10 minutes. So why to incubate at the 37 degrees Celsius for the 10 minutes? So we know that as a human beings, we have 37 degrees Celsius as the body temperature. So most of enzymes like to work at the 37 degrees Celsius temperature. So which is a temperature optimum for that enzyme. So that is why we are using this 37 degrees Celsius temperature, and we are giving some time for reaction to occur. So that is a 10 minute. Then we have to read the absorption of the standard and the test against the distilled water using the distilled water blank at the 505 using the green filter. So we are using 505 as a green filter. So which equipment we are using for this one? For getting the optical density with reading, we are using the spectrophotometer. So this one is the spectrophotometer. So let's see. So this is a equipment, spectrophotometer. Okay. So for example, this is a spectrophotometer radio equipment. So let's see the optical density. So here glucose concentration is equal to absorption of the taste minus absorption of the blank divided by absorption of the standard minus absorption of the blank multiplied by 100. So we have taken 100 milligram percent glucose. So that is why we are multiplying it by 100. Okay. So let's see if we are getting some image for this spectrophotometer. Okay. So this is a spectrophotometer. Okay. So here it is written. So good image, I think. So ABS is written here. So that is absorption, and here nanometer, 600 nanometer, for example. So you can use this as a. So this cuvette we are taking. So this is. So I was talking about this blank, standard, and test. We have to use cuvette. So this is a cuvette where we are using the blank, standard, and the test. You have to mix. Okay, and this cuvette you have to put in this cuvette holder in this spectrophotometer, and if you set it at how much 505 nanometer, that is a green filter, we say as a green filter. So if you put as a 505 nanometer, then you will get some optical density reading. Okay, so this is a spectrophotometer, and this is how we get optical density reading. So optical, for this you will get reading optical density one reading, blank will get one reading, or test you will get one reading. If you are putting in this equation calculation, the glucose concentration of the optical density of the test minus optical density, that is absorption of the blank, divided by absorption of the standard minus absorption of the blank, and multiply by amount of the glucose concentration. So you will get the glucose concentration in milligram per deciliter. Okay, so so that is how we do the test, actual biochemical test in our biochemistry laboratory, right? So blank, standard, and the test you have to prepare likewise. Next, coming to the interpretation part. So the normal range of the testing is the, so why to do interpretation? Okay, so why to do all this first, and why to take so much stress to do all these things? So because we have some normal range, if all as a human being, or as a all the as a cows or all dogs, they have particular range of the glucose in them, and we want to see whether this glucose range is getting higher or getting lower than the expected value. So this interpretation we want to do whether this have a hyperglycemia or the hypoglycemia, and based on this condition, if they have hyperglycemia, we want to go in detail why this hyperglycemia is there, what we can do about it. If it is hypoglycemia, what are the certain disease condition in which this hypoglycemia can be present, and what we can do about it, what treatment options we can follow. For that purpose, we have this biochemical testing done in our laboratory, right? So interpretation, the normal range of the testing is a 80 to 120 milligram per 100 ml of the blood. So this is 80 to 120 milligram per 100 ml of the blood, or plasma is a serum glucose concentration is about 10 times higher as compared to the blood glucose. Okay, so this is the 80 to 120 milligram per deciliter of the blood, plasma, or the serum blood or the plasma. Or serum glucose concentration is 10 times higher as compared to the blood. So if you are taking the serum sample, it should be 10 times higher. Okay, so ruminant, the glucose concentration is a 40 to 60 milligram percent, means ruminant have 40 to 60 milligram per 100 ml of the blood sample of this one glucose. If it is a monogastric animal, then we have 80 to 120 milligram percent. So 80 to 120 milligram per deciliter glucose we have in the monogastric animal. Hypoglycemia, this causes the decrease in the blood glucose. So interpretation, okay, so this is a normal range. So we want to come to one condition, let's say hypoglycemia, the glucose concentration is lower. You have found this is a ruminant, it is a 40 is should be normal glucose level, and you are getting 20 milligram per deciliter, or this is 80 and you are getting the 30 milligram per deciliter, for example. So this is a hypoglycemia, we call it as a hypoglycemia. And now let's dig into it. So the causes of the decrease in the blood glucose are the overdose of the insulin in the diabetes. So person has a diabetes and he is taking insulin dose, and morning he has taken insulin dose for uh, uh, taking glucose inside the cells, and he forgets that he taken that dose. So he again took syringe and again injected himself with the insulin. So that is bad thing. So that is overdose for the diabetes mellitus. He is having the very low glucose level in that case. So this is the hypoglycemia. Hypothyroidism, the thyroid gland is not acting properly, and if person has a hypothyroidism or dog has a hypothyroidism, then he can suffer from the hypoglycemia. So because we know this thyroid hormone is very important in the metabolism process, so uh, enhancing our metabolic rate. So hypothyroidism is there, means you can get the hypoglycemia. Certain tumors of the beta cells of the Langerhans. So if pancreatic beta cells of the Langerhans get some tumor, in that case we can get the hypoglycemia. Next, glycogen storage store dysfunction. So whenever we eat, we get glucose in our body. If it is a carbohydrate diet, and this glucose, if it is excess, it is stored in the form of the glycogen. And if there is some dysfunction in the glycogen storage, then we can have the hypoglycemia. Next thing, very obvious to persons is that starvation. So that is why the students comes to lecture, and at around 1 a.m. 1 p.m. Their concentration start to decrease. Why it is starting to decrease? Maybe he has not taken breakfast in the morning, and now his blood glucose level is low, and we know the most of the glucose in our body is used by the brain. So the brain is not getting proper glucose. In that case, there is a starting of confusion, and all nervous functions can be exhibited in this case. That is why the person who has starved, he may have somewhat less attention span, less attention compared to the person who is well eaten, and he is well fed, right? So the starvation is one of the condition in which person will get hypoglycemia, hepatic dysfunction. So if a person has a hepatic dysfunction, in that case also this hypoglycemia can occur. So the liver is a main site of the glucose storage, and many glucolyze like gluconeogenesis means site of gluconeogenesis or glycolysis. So these things can happen in the liver. So if liver dysfunction is there, so you can have the hypoglycemia. The neonatal hypoglycemia in the pig. So the pig is there, it has given a lot of liters, and these piglets, they are feeding on their mom, and there is a competition for feeding, and if some of the pigs is not getting proper nutrition, then they will have the hypoglycemia because the proper glucose is not coming into the piglets diet. So that is a neonatal hypoglycemia in the pigs. Okay, so these are the hypoglycemia condition. Which we have measured blood glucose concentration. So pig means, for example, 80 milligram per deciliter, and the pig's concentration of the glucose piglet concentration. So this piglet's glucose concentration is around 40 milligram per deciliter, for example. So in that case, we can suspect that it is a neonatal hypoglycemia in the pig. So based on age also, you can have some common sense how to interpret these things, right? So this was about the hypoglycemia. Next thing we have is a hyperglycemia. So hyperglycemia is basically the increase in the glucose concentration. So we have primary diabetes, in which the deficiency of insulin is present. So the diabetes means insulin deficiency is present. The type 1, in which the insulin dependent diabetes mellitus, also called juvenile diabetes. So insulin dependent diabetes is present in this condition, and type 2, which is the insulin independent diabetes mellitus, also called as a senile diabetes. Okay, so the primary diabetes has a two types. First is a juvenile diabetes, and second is a senile diabetes. Juvenile diabetes, type 1 diabetes is the insulin dependent diabetes. So already we saw the pancreas is there, it is not properly secreting the insulin, so that is a type 1 diabetes. Second diabetes is a insulin is a present, but the receptor for the insulin are the defective, so that is a insulin independent. Though insulin is a present, your cell cannot accept the glucose because the receptor for insulin is a defective, and now insulin, though it is present, it cannot attach with the receptor, and the glucose entry inside the cell cannot be done. So that is a type 2 diabetes mellitus. Next we have is a secondary diabetes. This is the commonest cause of the raise of the blood glucose and the chronic pancreatitis. So person, if he has person or animal, he has a chronic pancreatic fibrosis or autoimmune complex, that is antibody formed against insulin. So pancreas is there and it is getting fibrous. In that case, the insulin cannot be secreted properly, or autoimmune complex. So you have insulin, but usually whenever we talk in terms of immune system, we don't want immune system to act against our own antigen. So insulin is our own, we don't want to get antibody raised against it. But autoimmune diseases are the as such that they form the antibody against self antigen. So this is a self antigen insulin, and it antibodies form against it. So the immune system is activating, and it is trying to destroy this insulin, trying to induce the immune reaction in our body. So that is a secondary diabetes. So causes of the secondary diabetes are the pancreatic fibrosis and autoimmune complex. Next is a hyperpituitarism. Hyperpituitarism means most of thing our in our body are determined by this hormonal action in our body, right? So the hyperpituitarism means the pituitary gland activity is higher. In that case, hyperpituitarism, we get some glucose imbalance we can have. Chronic cirrhosis. So glucose imbalance means we can have the hyperglycemia if pituitary activity is higher. Chronic cirrhosis, if a cirrhosis, chronic cirrhosis is present, so the one of the cirrhosis means the this fibrosis of the liver present in the cirrhosis, chronic cirrhosis. If somebody is drinking too much alcohol for the long time, or if it has a hepatic condition, it means the hepatic viruses infect the liver. In that case, liver gets fibrous. In that case, the chronic cirrhosis, liver get damaged, a lot of fibrosis. Normal, this hepatocytes function is not properly. In that case, what happens is that already, as we discussed, the one of the function of the liver is to store the glucose. The glucose coming to the liver and it is stored in form of glycogen. So if it is not happening, the glucose remain higher in the blood unnecessarily. So that is one of the cause of this hyperglycemia. So chronic cirrhosis, administration of general anesthesia can induce the chronic cirrhosis, or prolonged beta blocker use. So if somebody is using the beta blockers, in this one, this cirrhosis can occur. Then hyperadrenal stage is there. Hyperadrenal stage. So in that one, the adrenal activity is higher, like in the Cushing syndrome or adrenal criticism, prolonged corticosteroid therapy. If you are giving corticosteroid therapies for the reducing the pain, then also we will have the higher glucose concentration in the blood. Or if you are giving some beta blockers, these things. So let's say beta blockers, right? So beta blocker. So if you are giving these beta blockers are the medicine that temporarily stop or reducing the body's fight and flight response. Okay, so this for anger, hypertension, arrhythmias, you are giving beta blockers, and if these beta blockers you are giving for prolonged periods of time, like for hypertension, somebody is having hypertension, he is always using beta blockers for hypertension, or somebody has a heart condition, arrhythmia, and he is using beta blocker. In those persons, the chances are there that someday they make sometimes they may have the hyperglycemia in their body. Okay, so that is the prolonged use of the beta blocker. Hyperadrenal stage means Cushing syndrome, in which so let's say Cushing syndrome. So Cushing syndrome. So basically, it is a hyperadrenal activity. Cushing syndrome occurs when your body expresses a high level of the hormone cortisol for a long time. So this is the cortisol. Cushing syndrome, sometimes called as a hypercorticism. By use of oral corticosteroid medication. So if you are using a lot of corticosteroid medications, you can have the Cushing syndrome. So hyperadrenocorticism. Okay, or you are using corticosteroid therapy for a long time, then also you can have the higher glucose in our blood. So that is a hyperglycemia. So this is one of the method of the testing of the glucose in our body, right? Gordon method, glucose oxidase peroxidase method. So next method we have is so this is a glucose oxidase enzymatic method. So we started here, we say principle here. Okay, this red aluminum form. So this is one of the equation concentration of so it is here in detail, absorption of test minus standard divided by absorption of standard minus blank multiplied by 100. So this standard blank standard test tubes we have prepared. Okay, we know this glucose concentration 40 to 60 milligram per deciliter. Based on this comparison of whatever result we get, we say either hypoglycemia. If it is hypoglycemia, we can again follow for this condition. We may suspect this condition, we may take additional test. Hyperglycemia, we may suspect it is a primary diabetes, secondary diabetes, hyperthyroidism, chronic liver or chronic cirrhosis, or either of this beta blocker or the general anesthesia. These things we can suspect, right? So this was the glucose oxidase peroxidase method. Next method is a Folin Wu method. So this is a conventional method. See, this is the one of the most popular method for determining the glucose in the clinical lab. Okay, so clinical laboratory is there, and if you want to determine the glucose concentration, so Folin Wu tube method is there. So this is the one of the most popular method for determining the glucose in the clinical lab, developing lab of developing countries. So it is for developing country. In the developing countries, this method can be used. It is economical, simple, convenient, and the results are the reasonable if test is performed carefully. So the plasma can be used. So we can use the plasma, the fluoride, which is additional advantage under the tropical condition with the high need and the poor transportation. So plasma can be used here. The fluoride can act as an inhibitor of the glycolysis and prevent the loss of the glucose from the specimen while waiting for the analysis. So we can add the fluoride, which is a glycolysis inhibitor, to avoid the loss. So if you are not adding the fluoride, in that case, as you transport the sample, the time goes on, your glucose concentration may decrease. So principle, the glucose on boiling with the copper, alkaline copper solution reduces the copper from cuprous to cupric to cuprous oxide. So this glucose we are taking, we are boiling with the alkaline copper solution and reducing the copper from the cupric to the cuprous oxide. Cuprous oxide 50 reduces the phosphomylidic acid to the blue colored molybdenum blue, which is measured calorimetrically. Okay, so here also we are getting some color, blue color, molybdenum blue, which can be measured calorimetrically. The intensity of the blue color is proportional to the glucose concentration. So here we are getting blue color. So in the Galford test, we have a red color. In this Folin Wu method, we are taking the glucose, we are boiling it with the alkaline copper solution, which is reducing the copper from the cupric to the cuprous oxide form, and then cuprous oxide 50 forms the reduces. So it is reducing phosphomylidic acid to the blue color molybdenum blue. So this is the principle of this reaction, and the blue color intensity we are measuring by the calorimetrically. So let's see reagents. So we have sodium tungstate 10% dissolved in the 10% in distilled water, 10 milligram. So how to prepare it? 10 milligram, 10 gram sodium tungstate you take and dissolve up to the up to the 100 ml of the distilled water in the volumetric flask. So this is a procedure for the 10%. So whenever we mean 10%, what we mean by 10% weight by volume is that 10 gram of the sodium tungstate we are taking and we are adding it in the 100 ml of the distilled water in the volumetric flask. So this is the one reagent we need for the Folin Wu method, 10% sodium tungstate. Next reagent we need is a H2SO4 solution, 2 by 3 normal. So we need a 2 by 3 normal H2SO4 solution. How to prepare? So to prepare one normal H2SO4, prepare at one normal H2SO4 by adding 100 ml of the concentrated H2SO4 to the 360 ml of the distilled water. So 100 ml H2SO4 you are taking, adding to the 360 ml distilled water. So that is a 100 divided by 360, that is 1 by 360. Next, do not add water in the acid. So always whenever we are adding concentrated acid like H2SO4, always remember you don't add acid into the water into the acid. You have to add acid into the water, and that is also slowly. Always add acid into the water, and that is too slowly. If you are taking acid and if you are trying to add water into it, it flashes out and it can damage your eyes, skin, or it can go all over your body, right? So that is risky. So remember, take acid and slowly add to the water. Then add 200 ml of one normal H2SO4 to the 100 ml distilled water. So we have prepared this one. First taking 100 ml H2SO4 into the 360 ml distilled water. Now we have this solution. We take 200 ml of the one normal H2SO4 solution and add to the 100 ml of the water. So that is a 2 by 3 normal H2SO4 preparation. Okay. So next, alkaline copper sulfate solution. Prepare solution in the following manner. So why we need alkaline copper sulfate? So here in the principle we discuss the glucose on boiling with the alkaline copper solution reduces the copper from cupric to the cuprous oxide. So alkaline copper solution we need for this purpose. So prepare the following way. Take 400 ml of the distilled water in the 1000 ml volumetric flask. So 400 ml distilled water we are taking in the 100 ml volumetric flask. Add the following dissolve. So we take sodium carbonate 40 gram. So we weigh the sodium carbonate 40 gram. Then take tartaric acid, weigh it as a 75 gram. Next, take phosphomolybdic acid solution, place following in the heat resistant beaker, 100 ml capacity. So how to prepare phosphomolybdic acid? So molybdic acid you take 35 gram, sodium tungstate already prepare this 5 gram, then NaOH 10% to the 200 ml distilled water. Boil vigorously for 20 to 40 minutes and cool and transfer 500 ml of the volumetric flask. Wash the residue with in a beaker with a flask with a small amount of distilled water until 300 ml total in a flask obtained. Then add a 125 ml of concentration of phosphoric acid to that is 35%. Dilute 500 ml with the distilled water and mix. So this is a laboratory procedure, right? So sodium tungstate preparation, 2 by 3 normal H2SO4 preparation, alkaline copper sulfate solution preparation, then phosphomolybdic acid preparation. So because these are required in our reaction, so we will see where it is required, right? So next we will do the glucose standard. So if you are, we need 100 milligram percent glucose sample. So 100 milligram glucose you take in the 0.1 ml, 0.1% benzoic acid solution, and then dilute them to the 100 ml with the 0.1% benzoic acid solution, because benzoic acid acts as a preservative. So we are preparing the glucose standard. You remember that for preparing glucose standard, we have to add 0.1% benzoic acid. The benzoic acid acts as a preservative. So for preserving glucose, it is act as a preservative. Next, working standard of the glucose solution. So working standard, you have to prepare 10 milligram percent. So dilute 100 ml stock of the glucose, that is 100 milligram percent, to 100 ml with a 0.1% benzoic acid, so that 1 ml of this solution contain 0.1 milligram glucose. Now we have prepared this solution. First sodium tungstate, H2SO4, alkaline copper sulfate solution, then phosphoric acid solution. Let's see where we are using here. Here we are using protein prefiltrate here. Then working standard of the glucose. So this working standard 10 milligram percent we are using here. Then alkaline copper sulfate solution we are using. We have prepared previously. Phosphomolybdic acid solution we have prepared previously. So for this blank, you add 2 ml of the alkaline copper sulfate, 2 ml phosphomolybdic acid. For the standard, we need a standard. So add a working standard 2 ml to the standard, 2 ml alkaline copper sulfate solution, then 2 ml phosphomolybdic acid. To unknown sample, we need protein prefiltrate, which is prepared from our sample. So 2 ml of this one, we want to determine the glucose from the sample. So 2 ml here, alkaline copper sulfate solution 2 ml, phosphomolybdic acid 2 ml. Then mix and place the tubes in a boiling water for the 3-minute cool tubes in the tap water. So we have to boil this all 3 tubes, keep it in the 3 ml cool tubes in the tap water, and then allow to stand for a few minutes until tubes till the tubes up to the 25 ml. Allow to stand for few minutes. This one, and then we invert the tubes by the inversion. Allow to stand for few minutes till the tubes up to the mark 25 ml till it thoroughly by the inversion of the tube. Then takes the reading at the 620 nanometer by the spectrophotometer. Note down. So here we are using the 620 nanometer. So here for this Folin Wu method, we are using the wavelength as a 620 nanometer. For previous, we have used a 505 nanometer. In this one, we are using 620 nanometer reading. So this glucose concentration in the milligram per deciliter is again formula OD of unknown divided by OD of standard multiplied by concentration of standard multiplied by dilution factor multiplied by 100. So special equipments needed is a Folin Wu Blood sugar test recommended for this test is especially designed to prevent the contact with the atmospheric water. So we have Folin Wu blood sugar tubes. Let's see if we can find this tube. So Folin Wu tube. So this is how tubes will look like. So whenever you will come to laboratory, if you see tubes like this, so this is a tube like normal tube, and here is a narrow portion, and here again the bubble is there. So this is a Folin Wu tube, right? So this you see is a Folin Wu tube, is a U tube. So basically the shape is like this. So shape is like this. So, and this is a Folin tube, right? So this is a Folin is a recommended for this test, specially designed to prevent the contact with atmospheric oxygen with reaction mix, which can be affect the result. So it is narrow because we want to prevent the oxygen contact with, during the reaction. So procedure: preparation of protein prefiltrate.